The broadcast is now starting. All attendees are in listen-only mode.
Well, hello, everybody. This is Jared Schultz, Esri's Health and Human Services Pattern Specialist, and I'm here for our first ever GIS for Health and Human Services meetup. This is going to be a little bit more of an informal process related to our typical webinars. We're going to be lifting the hood on kind of the workflow that I've demonstrated at the recent Esri International User Conference that was designed to demonstrate how the ArcGIS platform can be used to promote health equity, and it uses the dual epidemics or syndemics of opioid and homelessness. There'll be 10 minutes for questions at the end. You should have a little box interface through the GoToMeeting where you can enter some questions in, and my colleague Natalie Cardi will be monitoring those so we can get to those at the end. I wanted to do a little bit of housekeeping here and let you guys know that we've got another meetup, our second one, coming on October 17th, and it will be for community analysts. I'll have a link to that information at the end of the meetup here. And we've got our Health and Human Services Conference coming up in October 23rd out in Redlands, California at the Esri headquarters, so there's still a little bit of time to register for that. And then in November, we're going to have a focused insights meetup. And then in December, ArcGIS Pro. So you should be receiving some information from each of these in the coming week. And I encourage you to go in, if you're not a member of Meetup, to go in and register for the GIS for Health and Human Services group in there, where you'll be getting some more information. All right, so let's lay the foundation here a little bit. At Esri, we focus on all aspects of health and human services. But I'm going to be focused in on three key areas or three key initiatives that we've been addressing lately and engaging with a lot of different clients about their needs in these areas. And this is access to care and services, disease surveillance and control, and population and community health. So I'm going to be focused in on these kind of initiative or topic areas. All right, so let's get a little background here around health equity. Every community wants to be a smart community, and in order to be a smart community, there's a lot of different components, sustainability, well-run, prosperous, economic, prosperity, as well as health, which feeds into all of these different aspects of a smart community. And when we talk about health equity, we're looking at, kind of the disparities in wealth and income and resources in health. I'm sure that you've all heard this catchphrase that your zip code is maybe more important than your genetic code. The zip code, should not determine, your access to care and other types of things. So, we're kind of, using GIS or Geographic Information Systems technology to kind of dive into that question and look at ways of promoting health equity across a jurisdiction. So, we like to look at the health equity in a very holistic way. Here I've thrown up the definition from the American Public Health Association, just basically, that says that, there's a lot of different conditions that, feed into, communities having, adequate health equity. And it addresses a lot of different aspects of what's going on in that community. So I'm going to be looking at, that challenge of promoting health equity and how to use geographic information systems to kind of promote those concepts. And, you might wonder, and maybe not if you're all on this meetup here, why GIS and specifically ArcGIS applies to this topic of health equity. And from what we've seen from engaging with users from all over the world, ranging from, local government all the way up to international organizations, state, federal, is there's a pretty standard set of processes that people are doing out there to help address some of these issues. They're developing a plan which requires organization of a lot of data. They're they're responding to different types of incidents and situations that are out there that requires them to collect data. They're communicating information, trying to educate the public about what's going on with a particular issue, and then trying to mitigate that issue by deploying different types of tactics, whether it be, shore up the capability with adding new resource providers, community outreach, putting new policies and procedures in place. And all that requires, a lot of different, collaboration with, different decision makers, different stakeholders, community organizations, and other, local, state, and federal groups to kind of aid in that recovery effort, and as well as to engage the citizens to, make sure people understand what's going on in their community, where there's issues, how they can help, and, specifically what type of actions they can take. Kind of going through how GIS can help get at each one of these steps in this process. All right, so I've got a set of 3 different demonstrations that I'm going to walk through over the course of this meetup. I'm going to do a network accessibility analysis demo, a data exploration and analysis, and then a kind of an intervention and strategy demo. And I'm going to be taking on kind of explaining how different types of people in an organization would use our technology. But first, I want to focus in on the why or the where. And of course, that would be the first question that we look at when we're using geographic information systems, which are, so well suited to, address the location component of problems. I'm going to be looking at where overdose is occurring, where are the treatment resources, and where there are access issues across the community. And this type of activity would typically be done by a GIS analyst using desktop software. So that's exactly what I'm going to be demonstrating. For this accessibility analysis, I'm going to be using ArcGIS Pro, which is Esri's modern flagship desktop GIS software, the Network Analyst extension for ArcGIS Pro, and the Street Map Premium datasets from here to do some different activities. I've actually already geocoded the data that's going to be demonstrated in here. I didn't go through that process, but we've also got our base maps and other activities here. I'll kind of be highlighting the different components as I go through. So let's go ahead and switch over to ArcGIS Pro. And so what you're seeing here is my ArcGIS Pro interface. And for some of you on the phone that maybe you're not ArcGIS users, or maybe you're using ArcMap, which is our other desktop software, you'll notice that the interface is a little bit different here. It's a modern ribbon style interface. It's for the more tech-minded folks on the call, it's a 64-bit multi-threaded application. So it really allows you to take full advantage of your computing resources and do this analysis in a way that speeds up the process and is we think more efficient. The data that you're seeing here right now is mock data that I put together. The green stars are treatment resource locations, red are opioid overdose locations that are linked back to the homeless population. I've got some drive time analysis that I'll show a little bit later, and then some county boundaries. But again, this is all mock data that we have here. So let's go ahead and start walking through this analysis. And what I'm going to do is something called an origin destination cost matrix analysis, and it's a type of analysis that you can use to look at accessibility across a community. So here, I want to go in and click on my analysis button here. And you have a bunch of different options on the interface here. And I've got some ready-to-use tools here, which I'm not going to use, wouldn't use my local street network data set and other things, but it would use cloud-based resources. But I'm going to use all my local stuff since I am working with point-level data that would be, protected health information. I've also got some favorites here that I can set up and add different types of analysis. But I'm going to go ahead here and run my tools. And my geoprocessing comes up. I want to go ahead and enter a keyword here, which is make origin. So I'm going to make my underlying layer to run my analysis, and I'm going to click that. And you see I had a lot of different tools there. There's thousands of tools available, but I'm going to focus in on this particular cost matrix location-based analysis. So now it's automatically pointed out to my ArcGIS Enterprise portal to pull in my web services, but I've got this data local right now. So I'm going to go here and look at my database connections, and I've set some favorites up, and that's kind of one of the benefits of Pro, being able to map to different data sources that you typically look at. And I'm looking at my Street Map Premium data here, and I've got some routing data. In order to do kind of an accessibility analysis, I need information on the underlying streets, the speed limits, the directions on the street. And so I'm using the Street Map Premium data from here, but you could just as easily use your own centerline files or whatever else you have access to. All right, so let's give a output layer name here, and we will call it accessibility analysis. And then we have a number of different options that you can set here. I'm going to do drive time for my analysis, but you see I have walking distance, driving distance, different types of things. I'm going to do drive time. I have other options with cutoffs. I just want to find the closest location to each one of the overdose to the closest treatment resource. I have a lot of other things I can set, like my time of day and output geometry, and I'm going to do some straight lines here, and accumulation attributes. And this is kind of important because I want to track how far and distance it is, the travel time, and I also want to look at walk time here. So I'm running 3 different types of accessibility analysis here. Well, I'm just setting up the layer. So I'm going to go ahead and run this. And what that's going to do behind the scenes is build my street network file that I can use to route the locations and the distances on how to get from each one of these locations, which again are my treatment resource locations in green, to the individual overdose location. So I can tell how far it is to get from one to the other. And this is just an example that I'm using. This type of analysis is used pretty ubiquitously across health and human services, whether it's looking at accessibility across a health provider network or across an entire state to see how well people can access care and treatment when and where they need it. All right. So now I went ahead and I set my base level here, and you see I have my origins, destination, point various, and a bunch of different data. And now you can see I have a new option up here. If I click on this, it's my OD, or my origin and destination cost matrix. So now I can go ahead in here and enter in all the different options. So I want to import some origins here. My origins are my locations that the incident has occurred. So this will be my overdoses. So I'm going to go ahead here. It's like my origins. My input location will be opioid overdoses. And I have a lot of other options that I can set here, but I'm just going to go ahead and keep that default and run. And now what it's doing is it's taking my locations here where I have the incident, what I want to measure, accessibility, and it's going to go ahead and add those to my origin. So now you can see I've got all these purple dots here, which are all the locations of my overdoses. Next thing I want to do is set my destinations. And my destinations are the treatment resource locations. I have a number of other options, but I'm going to go ahead and go with the defaults on this and run that. And so now I've loaded up all those 21 treatment resource locations in there, and it's hard to see. They're kind of purple. They're rendered by default as these purple boxes here too. I'll change the rendering here in a little bit. And so now I've got my origin and destination. So now I'm going to run my analysis on that network data set that I set up. I'm going to stick with the drive time analysis that I did before as the primary default here. I'm going to go with one destination. I could do a cutoff where, say, I'm not looking at any locations that are further than 1 mile away or 2 miles away, but I'm going to leave it set up the way it is. I could also set it up so it looks at a certain time of the day, but I'm going to keep my defaults here because typically we try to set up our tools so that the defaults address the most common needs of our end users here. So let's go ahead and run this analysis. So what's going on right now is it is looking at each one of those origins, each one of those destinations, and calculating the distance, the network distance. It shows it in a straight line, but it's actually the distance on the road network, and all those accumulation variables that I entered in there, related to how long it was going to take. So now I have all that information, and to make it a little bit easier to understand what's going on here, let me turn this off. And I already went ahead and rendered the results where I took, the distance from each one of the locations and kind of graduated the color based on, the darker blue is further to travel, and the thicker lines indicate that it's further also. So now I have, all this information, but now I want to start exploring it. I can kind of preliminary see that I've got an area here over in the western part of the state with thicker, darker blue lines, which means these folks are having to travel farther. And as you can see, I don't really have a treatment resource location in that area. but I want to do more than just, look at it visually. I want to explore the underlying data here. So let's go ahead and pop up our attribute table. And go ahead and make it about this big here. So now I can see what's going on. And again, one of the, the nice things about, geographic information system is each one of your, your tabular records down here are linked back, to the tables and vice versa. So I can highlight any of them there, but I want to explore, some of this data. So let's look at this and look at my total minutes here. And let's do some statistics on that real quick and see exactly what we've got going on here. And I can see now that the mean travel time in minutes is 8.4 minutes from any one of these opioid overdose locations to the closest treatment resource provider. I've got all my different details on my charts, and I can modify that however I want. And I can even take the ones where, it's the longest, time here, and highlight them on the map and see, exactly, where those are occurring at and what's going on there across this community that I'm serving. But, we were talking about the homeless population, and they don't necessarily have access to a car. So let's see if we can look at how this relates back, to the underlying population of interest here, which would be, that homeless population. So here, if I go ahead and click on, total travel time again, instead of total minutes, and I want to do some statistics on that, or let's do summarize. Let's do summarize. And what I can do now is go ahead and take that information and add whatever fields that are in this table. So again, I want to go ahead and do total minutes, and I want to do a mean. And then let's do total miles. And again, I'll do the mean there. And then I'll also do total walk time and mean, and run that analysis. And now what I end up is some drive times, it's called drive time statistics, but it's actually, far more than that. When I went in there, and looked at each one of these and did a summary by them. And so now I can see what, the average times are. And let's go ahead and do that one more time real quick. Total fields, total travel time, and summarize. And I want to make sure that I'm not selecting anything here while I'm doing it. So let's go ahead and clear. And we'll open that up. And so then what I come up with here when I do that is an average, or the mean total walk time. So you can see before we had the average total time in minutes of drive, which was 8.4. But now when I look at, which doesn't seem like a big deal, but when I look at my population of interest, I'm now looking at an 83-minute average walk time, across this area here. So I've got a little bit more of an accessibility issue to this target population. So, I want to explore that a little bit more. What kind of actions can I take to help address that issue and improve accessibility, across the community? So I want to take this data that I created and the results of my analysis here as a GIS analyst, but I want to be able to share that information across to other members of my organization. So ArcGIS Pro, with its kind of web GIS-centric design, allows you to take any of your data, say my treatment resources here, and I could immediately share that information out as a web layer. And I've got all the information here that I've done in my desktop that I can now publish out to folks that maybe aren't going to be, using desktop GIS software and getting into it at that level. I've got a number of different options here. I've already published this out, but you can see where it's going to go is to my ArcGIS Enterprise portal, because I'm signed into that portal. I'm signed into that portal using my enterprise credentials, my single sign-on capability. So it's inside of my network, and it's where I can, put this data to be able to share it out with other groups. So let's go ahead and let's flip over to the second part of this demonstration here, which is kind of taking the data to the next level here. So now I want to kind of look at the why. Why are these overdoses occurring in this particular location? why these communities over other communities, what's going on in these communities that makes it different beyond this accessibility issue that we've just seen where there was no treatment resource location there. So I want to dig into that a little bit more. In order to do that, I am going to use something called Insights for ArcGIS, which is one of our premium web-based applications that are run either in ArcGIS Online, which is our SaaS solution, or in ArcGIS Enterprise, which is where you'd run this if you're working with this point level protected health information. I'll be using some Tapestry segmentation data, as well as the HereStreetMap premium data also, and that'll be my base map here. And, this workflow is more around kind of what we would expect maybe a data scientist, an epidemiologist, or other types of groups would use, after the GIS analyst has done this primary stuff to be able to, kind of explore this data and dig into it a little bit to understand a little bit more about what's going on. So let's go ahead and click over to that. And now what you see here is I've just got my browser maximized here, and I'm in Insights for ArcGIS. And you can see I have a lot of those same data sets. I have the municipal boundaries for, this area that I'm interested in, my treatment resource locations, and some other stuff. So now I want to be able to go in, I want to add those overdoses. I don't have them in here now. So let's go ahead and go add. And I want to look in my organization, and I want to search for overdoses. And now I can see I have my opioid overdose data. And I can add that. But you can see I can also go out and pull data from other sources. I can link to Excel files. I can even actually link to any relational databases that I have in my organization and add that data too. But right now, I'm just going to go ahead and add this opioid overdose data. And immediately by default, what's going to happen is it's going to pull that information in into its own map here. And it's also going to, pull it into my data pane over here. I don't necessarily need it right here in this map because I'm going to overlay it on my primary map here. So let's go ahead here, grab my layer since it's already spatially enabled, and add a new layer. So now basically what I've got is that same type of view that we saw at desktop. I've got the results of that analysis. I can see, my distance and all of my information here. And so I was able to take that information that GIS analyst produced on desktop, publish it out to a portal and then have access to it so I can kind of explore this data. And so we already know that we've identified, this low access area over here. But, we want to kind of dig into that a little bit more, maybe understand, why these overdoses are occurring in this area. So the first thing I want to do is go in and look at, let's say, my opioid overdoses. And I want to explore information on the date. When are these occurring exactly, at what time? So, well, first of all, let's look at our data here. Bring this up in a table, and you can see I have access to all of that information here in the underlying table. So I have information on those overdoses, and the nice thing about bringing it here into Insights is it takes the date elements and split those out so that I can now see it broken down by day of the week, time of the day, and other types of information. So I want to go ahead and see that out of a tabular format. I want to see it on a kind of a time series. So I'm going to grab this information and pull it over here and do a time series. And just that easy, I can drag and drop that information over and explore it in a little bit more detail here. So I can see a number of different things that are coming out. I don't see any obvious patterns, right out of the gate here when I'm looking at this just based on time, but I want to maybe explore this a little bit more. I'm going to dig down deeper beyond time, and let's go ahead and look at, say, let's go day of the week. And now it's going to break out each one of those overdoses and create a line for every specific day of the week. Now I can start exploring. And if I look at my trends on here, or my peaks, I can see, and again, it's linked off to my map. So if I click on the first one, only the corresponding overdoses are highlighted on the map here at Insights. But I'm going to click back out so I see everything. But as I scroll across and look at my legend, I can see the little purple line here is Fridays. And it seems like I have a lot of my spikes on Friday. for whatever reason. And I want to go ahead and dig into that a little bit more. And I actually want to look at, let's say, the hour. And now I also see I have some more spikes in my data pretty consistently across the time period. And they seem to be pretty consistently at about a 2 a.m. on a Friday in this kind of mock data that I set up. And immediately I start understanding a little bit more about what's going on. I mean, this information would be very useful, for my partners in health education and outreach, and even law enforcement individuals to be able to know when in the community they're seeing surges or increased amount of activity for this kind of adverse health outcome. In this particular instance, it's opioid overdoses that are linked to the homeless community. So I mean, I can start mining this data and doing some spatial and temporal data exploration here, and find out a little bit more about what's going on. And again, I can explore this based on any one of the attributes if I want to look at gender or race or any type of variable that's in my data set. Well, the next thing I want to do is maybe look at this data more of an aggregate level here. And so let's go ahead, let's turn our overdoses off here in the map, and I can just click real easily in that map there. And I want to drag this same data set over and put it in. Since I've already got it on the map, it's going to give me some spatial aggregation options here. And what I want to do is use those municipal boundaries for this geography. And I want to go ahead and summarize the opioid overdoses. And I want to style it by the count of overdoses. But I want to go in and select, I want to get some fields, and I want to do an average age, just so that I calculate some additional statistics here. And then I'm going to go ahead and run that. So now it's taken that individual point level data and given it to me at a different level, which is aggregated up, and it's giving me a graduated symbol here. But really all that I'm seeing right now, maybe let's turn off some of these other layers so that we can see it a little bit better. It's all I'm really seeing right now is the count of overdoses. It's not normalized by anything. So we're basically going to see more overdoses in areas, where we typically have higher population. So I want to go ahead and normalize this data. So let's go here, go to my settings, and I want to do divide. Well, I want to do counts and amounts colors here. So I have a fill. And then I want to divide it by the population in that area. So now I'm getting more of a rate. And now I can see a little bit more about, where I have, problems in this low access area here. And then you can see, across, that community, what's going on in that particular area there. So let's go ahead and turn our treatment resources back on and, our travel time so we can get back at that data that we were looking at before. All right, well, so now, I've got a little bit more about rates in this area. I understand a little bit more about the temporal aspect of what's going on, but now I want to dig back into that other question about, what is going on in this community. And, the one thing about doing any type of analysis in health is you rarely have all the data that you need in your systems. You may have access to, overdose information from maybe EMS providers, or maybe you've stood up our opioid solution templates where you can collect that information using tools like Survey 123, or pull it out of a vital record system or a coroner system, or mine other sources of data. But you still need other information, say on demographics and behaviors and rates of insurance and other types of issues to understand what's going on. So as a data scientist, using this type of tool, I want to start asking those questions. So I want to understand a little bit more about this community here. So let's see what kind of options we have. And if you do something called use the action button that's down here on the map, you get a bunch of different type of tools, aggregation, buffer analysis, find nearest density. But I'm not a GIS expert, when I'm using this tool. So we designed Insight so that folks can just ask simple questions and get simple answers, or ask complex questions and get answers that correspond to those. So what I'm looking at is trying to relate what's going on in this community back to the rates of overdoses that I'm seeing. So I'm simply going to ask, how is it related? And I've got a number of different options here. I can do core diagrams, regression analysis, link analysis. What I want to do is something called data enrichment. So I'm going to click here, And what I want to do is I want to go in and enrich this this normalized opioid overdose layer. But I'm going to go ahead and grab some data from the premium Esri demographic data sets here. And so I'm on the United States here right now. I'm going to look at some different things. I'm focused on the homeless population and opioids. So I'm going to look at some other risk factors that I'm aware of out there. I want to look at, say housing information and look at housing costs. And then you can see household rent. Look at maybe some underlying causes for homelessness in this area. And you can see I have all the ACS data here, the margin of errors and the numbers. But I want to look at households where the gross rent is greater than 50% of their income based on the most current ACS census data. So now I have one variable available for my enrichment here. Next thing I want to do is maybe go ahead and look at some of these categories and look at education. And now I want to look at the number of individuals that have a high school diploma in these communities. And again, there's lots of different variables that I can choose from. I just choose some here for example. And I can even go in and just do keyword search. Maybe I'm looking for unemployment. And now I can see not only do we have information from the census, but since Esri's got its own demographers and statisticians, we work with a number of different data sets and we calculate an unemployment rate also here. So I've got a 2018 unemployment rate. So let's go ahead and apply that. And I've got 3 different variables here. I'm going to go ahead and run that. And what's going on right now is a lot of us work with different geographic units of analysis. In this particular circumstance, I'm working with a standard unit of analysis, which is kind of a municipal boundary for this area. But a lot of times you use other types of boundaries that maybe don't correspond to a block group, census tract, zip code, ZICTA. And you want to be able to take data and apportion it into that area. So our geo-enrichment allows you to go ahead and do that information and attach whatever variable you want to whatever geographic unit that you want, and then apportions it. So it just doesn't, say something as simple, 10% of that area is in that block, so we'll get 10% of the population. It's much more complex than that. So let's go ahead and render this data here, and I want to style it, let's say, by let's do by the, maybe we'll go unemployment rate. And so now I can go ahead and see, and I'm sticking with my graduated symbols here, where now I'm looking at the unemployment rate, in that area, and see that I do have a higher unemployment rate over in this part of the community, and I can go ahead and access those underlying statistics that were added or enriched into that data set. So now I've explored, spatial, temporal. I've looked at some different, variables here. But now I want to go ahead and maybe look and see, visually I see what's going on, but is there an actual statistically significant relationship here? So let's go ahead and go down to this enriched data set that I just created. And you'll notice that I have those new variables here that were added into that data set. But what I want to go ahead and look at, my unemployment and my count of overdoses. And so I've highlighted or selected those 2 fields, and I can drag it across to a new area and I get a chart. I want to do a scatter plot. And let's go ahead here, do statistics and linear, so we can do a line of best fit. And then I can see my R-squared value. And you can see that you don't see a significant correlation between, my number of overdoses and my unemployment rate. And again, this is some hypothetical data here. So it's not showing that, but I can also go in and explore how the count of overdoses is linked back to any of my other enriched variable, education levels, not seeing a very high adjusted R-squared value there either, or going in and looking at, my, the cost of rent in this area. And again, so what I'm seeing now hasn't showed me anything too significant. It does reinforce, what we understand of the opioid epidemic, that, it's really indiscriminate and it is impacting all different aspects of the population here. So, well, with that being said, let's go ahead and dig down a little bit more and try to understand these communities. And so if I go here and go back to my data pane here and take some of that other data. Oh, actually I didn't. Let's go ahead and do this. I forgot to do one enrichment variable here, so we'll do that again real quick since it's so easy. I want to get my tapestry data. So let's go back and we'll do how is it related, enrich one more time, do the counts of overdoses, and I want to do tapestry. And I want to do the dominant tapestry segmentation for the household, apply and run. And I'll just take a minute. And so tapestry is something that's also produced by our demographers and statisticians. And it really allows you to dig down again into your data and understand those communities. So here I'm going to grab that tapestry, and here I've got my dominant tapestry segment here. So we'll go ahead and click that. Well, we'll click our overdoses and our dominant tapestry segment and drag that over. And I'm going to drop that one on a bubble chart. And now really quickly, what I'm seeing here is what's going on in that community. Let's turn off some of these other data sets here. So now I have the results of that new data set here, which is my tapestry information. And I can go ahead in there and look at that data a little bit more. I can click back on any one of these areas. I can see that, the most overdoses are occurring, in communities that are called savvy suburbanites. And if I click there, it immediately just highlights those areas on the map. And these are not the areas that I'm interested in. I'm more understanding what's going on in this community over here in the western part of the state. So I can click back out of that area and click on any one of these target areas here. And now I can see, in these areas that I'm very interested in here, they're in something called here, which is Parks and Rec. And that's the name of the tapestry segment. But what exactly does that tell me? So let's go ahead and take a little closer look at that. All right, so that's the tapestry segment. And again, this is some psychographic data that's developed by demographers and statisticians. And what it allows you to do is understand what's going on. Who are these people in this community? How many households in the US are in that community? What's the median age, median household income, socioeconomic traits? Get information about the market, demographic breakdowns, race and ethnicity. We even calculate our own diversity index. So here is one that shows that the average diversity index for the US is 64, and this area is 50.7. Basically what it means is the likelihood that two people selected at random in this community will be from different race or ethnic backgrounds. What are the primary occupations in this area? And some very useful information for kind of health education and outreach is the market profile. Budget conscious folks, where are they shopping at? What are they watching on TV? All sorts of information that will help you kind of, get back to that target population with whatever message that you're trying to target. All right, so let's go back here to insights. And one of the nicest things about insights, typically in health when we do things, we don't do a one and done. We're doing analysis, we're having activities, and then we're rerunning it. Maybe we're sharing it across an organization. So Insights goes ahead and records every single step of your analysis. So everything that I just did is recorded here as a model that I can then share out with other individuals in my organization, and they can just go ahead and pop new data sets into each one of these and run the exact same type of exploratory analysis that I just did. And I can even go in and share this information out as a story or a page for other people to explore this data, maybe even slice and dice it a little bit more. So it really provides a great tool for organizations to be able to collaborate and push the power of location out beyond just your core GIS staff. All right, so let's get into my last demonstration here, which is the how. How do we get started on solving this problem? How do we locate community partners to be able to address this issue? So to get into that, I'm going to kind of look at how maybe a planning and a director, an outreach director, educational director is going to, use technology. And for this example, I'm going to use ArcGIS Community Analyst, which is another web-based premium app. Our business data, our street map data, and some data that I've pulled in from other providers, which is SAMHSA as well as HUD. And let's go ahead and get to that. All right, so now what you're seeing on screen is Community Analyst. Community Analyst for ArcGIS. It's a great tool, browser-based tool, very wizard-driven, allows you to do a lot of cool things here. I've shared out that same data, I have it displayed here, but what I want to go ahead and is kind of dive into this. I want to do a suitability analysis. I want to identify if I'm going to place a treatment resource location where I need it in this community. What is the best community? Where am I going to get the most bang for my buck? So let's go ahead here, create some maps from data, and we'll run something called a suitability analysis. All right, and the nice thing about Community Analyst, it gives you all these instructions all along the way. I'm going to go ahead and add some sites from my project here, add sites, and I want to do, oh, actually I got to go back here and let's back up one step here and look at my underlying data here for Montgomery County. Create maps from data and suitability analysis. And I want to start with my features on the map, and I want to use my municipal county boundaries. And we can go ahead and we can look at these based on anything here. So I want to go ahead and look at a number of different locations here. So I'm going to focus in on some particular locations, which I'm going to do 106. I'm just going to filter out the ones that I want. I'm going to do 112. And these are just different jurisdictions that I just want to focus in on these areas for my analysis. I've got a lot of different areas here, but I've already kind of limited down what I want. And so I want to limit it to these 4 areas. And you can see as I'm clicking through, I'm removing all of the other ones. So now basically what I'm down to is just these 4 communities of interest here. So let's go ahead and create sites. I've got these 4 areas here and to go next. But now what I want to do is kind of, run a site suitability analysis based on a number of different criteria. So let's go ahead and start adding some criteria here that I can weight in my analysis. So let's go ahead here, add criteria, and we'll do a point layer. First thing I want to do is look at my opioid overdoses. All right, and close that information. And so now it's looking at, and by default, it does something where it looks at, the area that has the least is the most well suited. I want to reverse that. So I want to focus in on the areas where I have the most overdoses. And so now let's go ahead and highlighting this community here. That's kind of the first step or the first criteria that I want to consider. But the next thing that I want to do is go ahead and maybe add some different criteria. I looked at that parks and rec area. I want to focus in on areas that have more of that particular population. So if I go here to my browser and enter in, I'll just do the keyword of parks. And again, I have a lot of different data sets here. And then I've got my household segment and parks, and I want to do the percentage, or we'll do the number. I guess it doesn't really matter. Let's do the highest number of individuals that are in that particular category here. And the next thing I want to do is I want to go back here and I want to look at some of my behavioral data. And I've got a lot of different data sets here. Even if I look at health, I've got information on different types of insurance. But what I want to look at is some behavior data and individuals that, the percent of the individuals that are carrying medical, hospital, or accident insurance. And so what data do I have here? I have my tapestry segment and this. And the last thing that I want to do is maybe look at, we'll just apply these 2. So we've got 2. So I've got 3 variables here. I've got opioid overdoses, the tapestry segment here, and the number of people carrying the insurance. I want to go ahead and weight the overdoses as my highest criteria. And you can see here, once I weight that, it adjusts the percentages of the other ones. And then I can even go in here, and insurance, it did the same thing here. So I want to look at the inverse and focus in on areas where they have less insurance here. So now I've identified the area that meets my demographic profile, that has the most overdoses and have the most underinsured populations here. And then I'm getting my underlying score. So I've kind of identified the target area that I want to focus in on. You can see the value, the score, and the weighted score for each one of those variables if you click in there and look. But now I'm going to go ahead and explore that area a little bit more. As a planning director, I want to understand what's going on. I want to really plan my activities correctly. So I want to look at this particular community here. So if I zoom in on or click on the area of interest that I've identified, I have a lot of different reports and comparison tools, but I want to look at an infographic here. And what I can do now is look at all the underlying information for that community. I can access that same tapestry information, but I can look at education levels, employment levels. I can see how that particular jurisdiction relates to the surrounding county, neighboring counties, the entire state, or the whole US. So I can start to see how it is different from surrounding areas. And I can even go in there and I can print this information. I can customize this infographic with my own, logos and other information, share it and print it out in different formats, and whatever I need to do to, get this into my reports or communicate it with the rest of my team. Well, the next thing that I want to do here is I've identified this area, understand a little bit more. I want to go ahead and maybe overlay some potential, businesses here that I could partner up with in this community, either to provide treatment resources, education, whatever I need. So if I go here and go back to my create maps from data again and do something called the business and facilities search, I get a lot of different options here. And I just want to search for, the particular area. I want to find any businesses in the target location here. And what I've done is I've already identified the code that I want to use, the NAICS codes, North American Industry Classification Standard, and go ahead and pull that out. So now I've identified these two different, businesses in this location that could be potential partners for me. And I have a number of different options here that I can do to render that data and work with that data. But, for right now, it was just nice to be able to identify that location and those potential partners. Well, the next thing that I want to do is try to, find out what type of federal resources, what have my federal partners done in this space? How can I take, the results of their work and analysis and kind of plug it in here? So to do that, I'm going to go ahead and add data, and I'm going to import some data. And what I did is I went to the SAMHSA website and pulled down the medically assisted treatment providers where they have that data set that's available. And I want to go ahead and import that and put that on my map using this underlying street data. And so I map across with my addresses in my spreadsheet, to how they're stored in my geographic data. And now I can take those entire all those providers for the state of Pennsylvania here and put them on my map. And let's go ahead and change. I can't really tell the difference between that and those businesses that I pulled. So we'll just use a different symbol there and zoom back into my area here. And now I can see, I've got these locations that I identified for my business listings, which, is a dental provider, family practice. But now I've got an identified treatment provider here in the location also. So now I went ahead and, pulled a lot of different data sources of potential partners that I can collaborate with and things that I can do here. Well, the next thing that I want to do is be able to take the data that other people that are using GIS tools have shared out. And there's a lot of folks out there using these tools. So I'm going to go ahead and add some more data to this map. And let's do web maps and layers here. And you can see I have a lot of different options here, to look at data that's in my portal. But I want to look out in our official Esri content, look at ArcGIS Online. Let's do continuum of care. And what I can see here is HUD has shared out all the COC boundaries, and a continuum of care, is an organization that's tasked with addressing issues around homelessness in their particular jurisdiction. And now I can overlay that data for the entire United States and click and immediately get the information for who is the primary point of contact for homeless issues in my surrounding communities here. So I didn't have to go ahead and spatially enable that data. I just went and found other data sets that other GIS individuals have shared out there. So, I was kind of able to leverage these tools, across different, kind of roles, people with different capabilities in my organization, and do kind of this type of complete, health equity analysis. And these tools, to kind of wrap up here, then we'll open up the floor to questions here. They're being used, by many different users, across the world right now. Here's an example for the Northern Kentucky Health Department that have leveraged some of these tools to look at, opioid abuse, putting out very informative story maps and mapping out all sorts of different information beyond just what I displayed here. You've got groups like DeKalb County, Georgia, that's done some amazing work on going out and counting all their homeless individuals, using field data collection tools and dashboards and everything else to get immediate insight into where those individuals are at. And groups like, Rancho Cucamonga and Redlands that have partnered together between their law enforcement and other groups to better serve homeless and address issues related to the homeless populations and subpopulations like veterans and children's. And kind of conceptually, we went through this whole process that I had mentioned earlier, where we collected data, describe the community, identify root causes, and then provide the tools to be able to measure what's going on and really address this issue holistically. And we didn't just use a desktop environment, we expanded out to an enterprise portal, and then we even use these capabilities to link organizations and departments inside the organization, but also connect with outside groups like HUD, and take the SAMHSA data. And then all this information is accessible across an organization to make better, more data focused decisions in the future. So it really is a tool to connect communities, not just public health, but human services and law enforcement and federal agencies, and able to leverage the great work that everybody's doing and work together smarter. All right, I want to go ahead and open the floor up to questions, but there was a couple things here that I wanted to point out. We'll have another meetup around Community Analyst October 17th, and there's a little link there. I think that this information will all be shared out with all the attendees. And we've got our upcoming conference, in Redlands here on the 23rd. And then if you wanted to, email me with any additional questions or check us out on LinkedIn or Twitter, all the information is there. And so I will go ahead and open the floor up to any questions. I think Natalie has been monitoring these, so we'll see what we've got.
Yeah, thanks, Jared. This is a great presentation. We do have some questions coming from the audience. One of them is to do with your insights demonstration. They were wondering if you are able to do p-value calculations.
It calculates a lot of different information related to, so you were saying during the regression analysis?
It was during the insights part of the presentation.
There's a lot of different statistical tools and capabilities that are in there, chord diagrams, link analysis, scatter plot regression charts that allow you to explore a number of different data sets. I don't know if the p-value is a default statistics that's produced from there, but Natalie will get your contact information, and I will respond back to you with more details and links back to our health documentation that explain all the different statistics that are produced.
Okay, thanks, Jared. Another question we have is beyond spatial weighting, how does Insights do apportioning of data into different geographic boundaries?
Yeah, well, this gets back, and again, if we have your contact information, I'll send you a link with more detail, but at the highest level, what it does is it takes your boundary. If it's an irregular shaped boundary that doesn't correspond to any kind of census unit of analysis, we store the data at the block group level, zip code level, tract level, number of different levels, but we also use, block centroids. So if your area doesn't correspond to any of the boundaries that we store our data at, we overlay it. We look if that, kind of that weighted population centroid falls in your area, and if it does, we apportion more of the population. So it's not just, this area is 15% of a census block, so I'm going to put 15% of that population in there. It's more based on, what we all know as GIS professionals to be true, that population is not evenly distributed across the geography. It may be that 75% of a population for a particular block or block group is in 15% of the area. So we have documented methodologies, and there's been blind studies using this in other demographic data sets, and it performs very well, and it's all documented because we know if you guys are going to use these tools to make policy decisions, you've got to be able to back them up. So that underlying methodology has got to be transparent. So we can send out information with detailed links to that methodology, but at the high level, that's what it's doing. It's doing, based on weighted centroids, doing apportionment based on percentages, but it goes beyond that.
Okay, thanks, Jared. I actually think we have finished with our questions. So, yeah.
All right. Well, I guess that we can end it here a few minutes early and give you some time back. But, I hope this was useful. I hope that you guys will all also go. There's a couple of links in the side stage here on a health equity industry perspective that we've produced that kind of talks a little bit more about some of this information, and, register for these GIS for Health and Human Services meetup groups so that you can get more information on what's going on. But correct me if I'm wrong here, Natalie, they will all get links after this to recordings and the other information.
Yes, by tomorrow you all should have an email that is sent to you that has a recording in it.
All right. Well, excellent.
All right, thanks all.